We're thankful to have with us today environmental scientist Anna Costello from our Childhood Lead Poisoning Prevention branch, who will be providing a very brief overview of our program goals and functions. In addition, we are grateful to host lead poisoning prevention program staff from Fresno County, including health educator Leticia Berber, registered environmental health specialist Bee Vang, and public health nurse. Bee Vang is the public health nurse. Michael Dang is a public health nurse. Senior media buyer Christina Chan from JP Marketing, and last but definitely not least, we are thankful to be hosting Sony Johnson from Alameda County Lead Poisoning Prevention Program. Fresno County is going to showcase the fantastic work they're doing around outreach and case management, as well as some of the strategies they take to secure Department of Housing and Urban Development or HUD grants. While Sony Johnson from Alameda County will discuss some of their strategies around how they engage with local communities and organizations to mitigate lead poisoning through partnership building and collaboration. Please feel free to ask any questions you may have during the presentation in the Q&A, and we will be making some time at the end of the presentation for further discussion. So without further ado, please join me in welcoming our presenters. I'm handing off to you, Anna.
Hi, thanks so much for the warm welcome, Eric, and it's wonderful to be here today. My name is Anna Costello Duran. I'm an environmental scientist with the State Lead Poisoning Prevention Branch, and really grateful this morning to offer an overview of our entire statewide program, its goals and functions. So the Childhood Lead Poisoning Prevention Program works to eliminate childhood lead poisoning by reducing exposure in California's children through several different mechanisms, from education and outreach to healthcare providers as well as communities, to environmental inspections to identify lead hazards, and also public health nursing services to children with identified elevated blood lead levels, as well as data analysis to support families as well as communities. The program vision is a healthy, lead-safe environment where all children can achieve their full potential. And I also wanted to offer the program mission, which is to eliminate childhood lead poisoning by preventing environmental exposures to lead and identifying and caring for lead-burdened children. If we can move to the next slide. Thank you. So our program accomplishes its vision and its mission throughout the work of over 49 contracted local childhood lead poisoning prevention programs throughout the state of California, as well as 6 program areas or sections within the state's Childhood Lead Poisoning Prevention branch. So some of the functions that are provided by the branch's work at the state include the areas of community education and outreach, as well as direct case management services to 12 local health jurisdictions, and additionally oversight of case management services to the 49 local programs that are contracted. The state also provides education and outreach to healthcare providers throughout the state of California. Additionally, another section provides support in the area of lead hazard reduction, which works to reduce childhood exposures to environmental lead hazards. Another function is evaluation and research for surveillance purposes, which includes blood lead data analysis and management of clinical laboratory electronic blood lead level reporting. And lastly, we have our program administration and fiscal functions, which work to oversee a successful program being administered statewide and adequate resources provided to all of our local programs. Next slide. Thank you. So to delve a little bit into some of the work that's done around blood level reporting, this is one of our critical functions of the statewide program. And as you can see on this slide, there are over 700,000 blood levels reported to the state branch annually. And the state receives data from all blood level testing that's performed. As you can see, we wanted to give a little overview of some of the services, the direct services that are provided throughout a 49 contracted local health jurisdiction programs. And these are done to elevated blood level cases. As you can see in the third row here, new full cases. These are cases which receive full case management services, which includes a combination of public health nursing services, as well as a full environmental investigation to determine the sources of lead exposure and be able to take actions to reduce them and mitigate the damaging effects of lead poisoning. Additionally, you can see data for new basic cases, which receive at minimum blood level monitoring, outreach and education, and follow-up with the healthcare provider to encourage venous retesting. Additionally, services are provided to these cases at graded levels as resources are allowed at the local health jurisdictions. As you can see, the case load has increased over the years, and management services are provided to families at great amounts throughout the local jurisdictions to prevent further exposure and mitigate its effects. So I wanted to delve into a little bit more with the next slide about some of the services that are provided to these families and communities. For all children under the age of 21 within California that have the full case-making blood level, regardless of their income or documentation status, all receive full case management services. This includes public health nurse home visits, which has a combination of outreach, education, a full comprehensive interview of the family and their exposure history, as well as checking products that are used around the home. This could include cosmetics, home remedies, and other items that could potentially expose the case to verify that they do not contain lead. Additionally, case management includes coordination with the healthcare provider of services for coordinated care, and an environmental investigation is provided at the local, at the family's residence. Their primary residence is tested for potential hazards in paint, dust, soil, and water to mitigate exposures and identify any lead hazards that might be at the property. Additional actions include ensuring that correction and remediation is happening for all identified lead exposure sources, and follow-up and monitoring will be done for this case throughout its duration. Next slide. So moving forward, we wanted to provide some context around a recent project that was taken on by the program. We underwent a strategic planning process to serve as a program work plan and to create an action-driven approach to integrate our priorities within our daily activities. So this strategic action-driven approach has included topic areas of developing an actionable plan to improve primary prevention. Additionally, deliver robust case management services throughout our state, as well as enhance collaboration with community-based organizations. These strategic planning approaches will advance public health interventions through data-driven research. Additional mechanisms that are incorporated into our future plan include training and technical assistance for all of our local childhood lead poisoning prevention programs across the state, and establishing an institutional commitment to advancing health equity throughout the state. Through implementation of the strategic plan, we hope to foster unity, clarity, and a strong pathway forward to achieve our program's goals and work towards eliminating childhood lead poisoning across California. Thank you so much for taking time to learn about our program today, and we look forward to working together to strengthen our collective efforts to better serve families around the state. I'll hand it back to Eric. Thank you.
Thank you, Anna. For our next speaker, we're going to go ahead and turn it over to Fresno County Childhood Lead Poisoning Prevention Program.
Thank you, Eric. My name is Letitia Berber. I'm a health educator for the Fresno County Department of Public Health, and I oversee the health education and outreach component of the Childhood Lead Poisoning Prevention Program. Next slide. Thank you. The Fresno County Childhood Lead Poisoning Prevention Program would like to give thanks to the Childhood Lead Poisoning Prevention Branch on giving us this opportunity to highlight the work that we are doing in Fresno County. What we're going to do is touch up on 3 sections here in our department when it comes to childhood lead poisoning prevention. And the first one is overview of the outreach and education. We do have 2 campaigns that we promote throughout the year, and JP Marketing is an agency that is under contract with us that does all of our campaigns, not just childhood lead poisoning prevention program. We have multiple campaigns, but we want to go ahead and invite them on for them to elaborate more on the outcomes that they see, the measurements that they take in order to produce a robust campaign, and just explaining how they go about on how they measure each campaign. And Christina Chan, who's a senior buyer at JP Marketing, will go ahead and present on that. We want to highlight the overview of the case management that we have. Michael Deng, who is a public health nurse here for the program, he'll go ahead and touch up on that section as well. Fresno County is a fortunate county to be a recipient of the HUD grant. We're just so gracious to have this grant here, part of our department, because not only do we just identify children that are lead poisoned, but with this grant, we're able to take a step, an extra step, and that is to remediate and make their environment lead safe. B. Beng, who will be talking about the HUD grant, go into details about the collaboration that we have with communities and contractors that work under the HUD grant. So I'm going to go ahead and leave it to Christina Chan to go over the outreach and education that they do for us.
Hi, good morning, everyone. We can go ahead and switch onto the next slide. And thank you so much. Yes, we are here at JP Marketing. We are a full service agency here in Fresno, California, that assists the Fresno County Department of Public Health with all of their outreach efforts. And our next slide just goes into a little bit of the staff, or a few of the staff on that works on this account. And our next slide goes through our approach that we really like to have for all of our campaigns. So a great thing that we like to note is we can't hit a target we can't see. So we've been able to really develop a great relationship with Fresno County and really identifying what those key successes are, as well as what those measurable outcomes are going to be that will essentially play a large role in future campaigns and repeat campaigns on what worked well and what didn't work well for us. And next slide. We'll be going into the details for our spring and fall flights that we've had. So Fresno County being the second county in the state with the highest number of children with high blood levels, and also being one of the largest counties in Fresno or in California, it's definitely a diverse population. So we will always have to use multiple languages, as well as really ensure that we're being as efficient as possible with our budgets. So listed here, we have our target, of course, of Fresno County residents with the priority of low-income communities and zip code targeting where available in a lot of the areas with large reported lead cases. And our mediums include traditional channels like broadcast radio, as well as rural outdoor placements, along with digital and paid media and streaming platforms where available. And we'll go through our next slide, please. And this slide goes a little bit further into our strategy. So again, defining the target Fresno County residents, of course, with a priority of low-income communities, and wherever we do have the ability to granularly target zip codes, that'll help us ensure that we're really reaching who we need to. Determining our media platforms and channels. So we have spring and fall flights, of course, but then really using the behavioral research available publicly, whether it's using census data or additional market knowledge that we have access to through our media vendors to really correlate the target demographics to our media consumption behaviors, and really making sure that all of the media platforms and channels that we're using really do efficiently target who we need to reach. And then here we have our language and budget considerations. Again, depending on what our budgets are, some mediums will be able to use and others not as much, depending on cost per thousand and how expensive a lot of these mediums may be in the long run. And our next slide. Perfect. So here we have our lead poison prevention results from our spring campaign. And by looking at the zip codes that we had listed here, we were able to see that a lot of the habits in these areas did result in a lot of mobile usage, and that could depend on access to internet services, adequate services, or just no internet access at all in the household due to income constraints. And with that, we are able to use a mobile first approach. And then we also see longer social media consumption habits, resulting in making sure we do have digital mediums included in our plan. So for this campaign, we ran a multimedia campaign consisting of traditional radio, digital display banner ads, digital video, along with social media ads and an outdoor board located in one of the hot zones in our zip code list. And really, our campaign objective was to increase awareness about the dangers of lead poisoning, but as well as encourage parents to get their children aged 12 to 24 months tested if they've been potentially exposed to lead. Our next slide. And this just goes through our budget as well as our campaign wins that we definitely want to highlight by using this strategy. So again, with our budget of around 13,000, a large campaign win for us was a 0.32% click-through rate, which is essentially just the percentage of clicks in comparison to impressions for March's campaign, which is 300% higher than the industry average of 0.08%. Along with that, by leveraging a lot of our media partners and relationships that we do have in the market, we were able to negotiate an additional 32% extra of traditional impressions in March, which was an estimated media value of a little over $5,000. And this rounds us out at 3.2 total million impressions, along with 11,000 clicks to the website. This strategy definitely helped us in really gauging what worked for us, and we really wanted to highlight this win, especially because of the click-through rate, where residents were able to access additional information on the Fresno County website on services available, as well as potential risk areas in their households. And our next slides go through our year-over-year media campaigns and results. And our next slide. We do see from 2018 to now, we have been able to conservatively allow for larger impression share within the market, as well as see a steady click-through rate of over 0.6. And from 2018 through 2021, we do see a total impressions total of a little over 10 million, with 66,737 clicks to the website, as well as an average across year over year at a 0.6% click-through rate. And our next slide. This just goes into a little bit more of our campaign timelines that we have throughout the year, and we do see lead have a pretty long, we'll say month over month campaign flight. And this is where we also make sure we strategically have messaging around timelines where either we don't have a lot of messaging going on, where we're able to really capitalize on the messaging efforts throughout the market so that our message doesn't potentially get lost throughout the year. So it's a lot of, we'll say, placements throughout the year and really ensuring that we strategically capitalize on our timeline and our message gets heard where it needs to be. And next slide. Thank you so much for having us on this morning. We really appreciate the time to be able to share our strategy and marketing efforts, and hopefully these are able to be duplicated in other markets across the state. Thank you.
No, B was able to chime in. B, are you on?
I am. Can you hear me?
Yes, we can hear you.
Okay.
Can you see the slides?
Yes.
Okay. Whenever you're ready for the next slide, just let us know.
Okay. Okay. You can hear me okay, right?
Yes.
Okay, let's go back to the beginning. Okay. So this is Dee Vang. I'm with the Fresno County Environmental Health Division, and I am a registered environmental health specialist and an EP for the CLIP program. And along with my team, I do conduct the environmental investigations for all the state cases that come through our department. Next slide, please. So for my portion of the presentation, I will be going over how we get the property owners and the tenants to cooperate or to enroll into the grant to help them remediate the lead hazards that we identified during the EI. Okay, so when we get an EI from the state, prior to the investigation, our staff do have to do some sort of research to see if the property is a pre-1978 or not, because if it is a pre-1978, then we have to gather some paperwork and get ready for the investigation so that we can provide the application to help the family enroll into our grant. So as you can see, I don't know how clear you guys can see on the right. I do have a picture of the assessor's page with the year, and then for the application process, we do have the checklist where it showcases all the paperwork that we have to collect during the application process. Okay, next slide, please. Okay, so to get the tenant to cooperate, there is some education that we have to provide, because we do have cases where the tenant refuses to cooperate because they believe that they don't believe in helping the property owners to have the place remediated and to increase their property value. And so when we have cases like this, we have to provide education to the tenants. We have to explain to the tenant that they are the one to be receiving the direct benefit of the remediation. And by allowing us to do this, we are creating a lead-safe environment for the tenants who are being exposed to the lead hazards every day. And so once we do that, they can have peace of mind that the family is living in a lead-safe environment. And not only that, we are providing the tenants CDPH licensed lead-safe workers. And on top of that, we want to reiterate to the tenant that this is a no-cost program to them. Next slide, please. And to get the property owner to cooperate, once we go out to the EI, we identify the lead hazards. We are notifying the property owners of the lead hazards that need to be remediated. In the letter, we do specify the time frame as to when they're supposed to get the remediation done. And if they don't get it done and we show up for a reinspection, we do charge them a $109 reinspection fee. If they don't want to provide remediation out of their pocket, we do provide a program at no cost to these property owners. And most of the time, they will opt for the program. Next slide, please. For our program, it is a really hard challenge for us to get contractors to come on board with our program. And so in the past, when we started this program, we did provide our RP training course to the contractors and to the public. With this process, we were able to recruit one contractor, and the other method that we utilized to recruit contractors to come on board was just visiting the California Contractor State License Board to obtain lists of the certified contractors. When I got the list of the contractors, I was just calling these contractors out of the blue to see if they would be interested in coming, being contracted with our program. It is really hard to get these contractors to be contracted with us because of the amount of requirements from HUD and from CDPH. And the other three methods that we utilized in the past to get the word out to these contractors to come on board, which is basically word of mouth, media outreach, and outreach by leaving flyers at the hardware stores. Next slide. And from now on, I'm going to explain to you guys exactly how the process is carried out for each project for the HUD grant. It is a very lengthy and time-consuming process for all of our projects. Okay, so first of all, when we get a pre-application from the public, we review the information that's on the application because we want to make sure it qualifies with the year of the construction and the income before we go out to do an inspection or to start the process. So what we do is when we receive these applications, we would schedule a pre-visual inspection. And what we do during the pre-visual inspection is visiting the site, testing the paint on the property or on the dwelling to see if it is positive for lead-based paint. We use a lead check swab, and I know that even though it's not a quantitative measurement, it is a qualitative measurement where it's telling us that it is positive for lead-based paint. Once we find out that this property is positive for lead-based paint, then we will continue on with the full application because the full application itself is a pretty lengthy process. It's about 14 to 17 pages. And for the full grant application, HUD does require that we collect all financial documents from the applicant and the bank statements. For individuals that are self-employed, we do provide a self-certification for them to self-certify the source of income and the amount of income they are receiving on a monthly basis. And this program is for low income, and so of course, the financial documentation that we do collect from the applicants, it has to meet a threshold level. Next slide. So once we do the application and we receive all the financial documents, we qualify the applicants based on the financial documentation that was provided to us from the tenants. Once we know for sure that the home and the tenant qualify for the grant, we'll send the project over to the Historical Society for a historical review. And during this process, the specialist is reviewing this property to make sure that there is no historical significance on the project. After the process, once we receive that comment, we package this whole application where it's sent off to the Public Works for the Tier 2 environmental review. And the purpose of this process is to ensure that the remediation project that is going to be taking place on the project does not have any environmental impact for the neighbors and the environment around it. We are required to complete this rating sheet to rate all of the applicants. Our priority is given to like the state EI cases, or the older the home, it gets more points. And so this would determine which project or which applicant will have priority over the ones that are not a state case or homes that are like in the 60s or in the 70s. We also request for a letter after the income qualification process, the historical review, the environmental review, and the rating process. We are contracted with Benchmark, and so with Benchmark, when we have about 7 or 8 layers that are ready to be scheduled, we do request for our vendor to come out to do a layer, which is the lead-based paint inspection and risk assessment. Our vendor, she's pretty good. She's able to give us a report within 5 to 7 days of doing the inspection. So once we receive the layer or the report from our vendor, our staff reviews the report thoroughly to identify the lead hazards that were identified during the inspection. After reviewing the LARA and the lab results and the XRF shots from the vendor, then our staff drafts the scope of work based on the identified lead hazards. Once the scope of work is done, we would draft a bid scope of work. And the difference between the bid scope of work and the scope of work is that we itemize every lead hazard that was found during the inspection, so that we can send it out for the contractors to put their bid price on it. Once that portion is done, we put everything together and we send out a email to the contractors to schedule the bid invitation or the bid tour. Next slide, please. So during the bid tour, the contractors that show up during the bid tour are only allowed to bid on the property. We do have cases where the contractors cannot come during the time we set. In cases like this, we do allow them to give us a call or notify us that they're not able to show up and that they will be going on their own time. If they're able to notify us in advance to the bid tour, we do allow them to send the bid price or the bid submittal to us too. And I just want to explain the difference between the bid tour at the property before and during COVID. Before COVID, we were able to go on the inside to visit and view the components that are needing the remediation. But during COVID, we're not able to do that because we want to minimize our exposure with the tenants and we want to minimize their exposure with our contractors. And so during COVID, when we do our bid tours, we're just staying on the outside. We're just viewing the lead hazards on the outside, and our contractors are very experienced. So although they are not able to go on the inside, they're able to review the lead hazards on the bid scope of work and put a price to the interior lead remediation. Within 3 days, our bid submittals are usually due 3 days after the bid tour at noon. So we are required to take or award the contractor with the lowest bid price. Whichever contractor is awarded with the project, we do initiate the contract signing. Once the contract is done, the contractor is required to provide an occupant protection plan and a lead abatement plan. The occupant protection plan is basically telling us what the contractor is doing during the remediation of how he can protect the occupant from the lead hazard or the work that they're doing. And the lead abatement plan involves the contractor drafting out the exact work that he will be doing for the remediation project. Once that is received by our staff, the contractor communicates with the property owner or the tenant to see when he can start on the project. Prior to starting on the project, he sets up a containment verification, which is verified by our staff to see if they are following regulations. If we verify that the containment is set up properly, then we will allow the contractor to proceed. Once the contractor is done, he reaches out to us that he is done and schedules a clearance inspection with our staff. When we go out to do these clearance inspections, we are visually checking the property to see if all debris have been cleaned up and if there's any visible paint chips on the property. If it passes, then we proceed with the clearance inspection. If it doesn't pass the visual, then we can't proceed with the clearance. and we would notify the contractor to come back out to properly clean the property. There are cases where we have to go out 3 times, 4 times, 5 times, 6 times to get the property clear. I just want to let you know it's not perfect. Let me see. Next slide. Once we complete or once we conduct the clearance inspections, there is a clearance report that is followed with the clearance inspection. Once all that is done, then we can initiate the notice of completion where we have to get the property owner and the contractor to sign that everything has been done and carried out according to the contract that was executed. Once the notice of completion is signed, then we will send the invoice over to the business office to get payment over to the contractor. Once all that is done, we do put this disclosure packet together so that we can deliver it to the contractor. And in this disclosure packet, we do have the report, the clearance report, the signed contract, any other documents that are affiliated with this project are being delivered to the property owner. And we do have the disclosure certification for the property owner to sign, acknowledging that he or she did receive the paperwork associated with the project. And last but not least, the one thing that is required by HUD that we do is the 1-year monitoring, because our contractors is required to give a 1-year warranty for the project or the remediation that they do, meaning that within that 1 year, when we go back to visit the project or the property, and if we see any paint deteriorating or any cracking in the paint, we do require the contractor to go back out to either repaint it or to provide a fix to this problem. And so far, we've been pretty lucky with the projects that we have done. I think there was only like 1 or 2 projects that the contractor had to go back out to get the problem fixed. And, you know, I want to emphasize that the key component of getting the project enrolled into the grant and completing it till the end is the communication we have with the property owner. It is really important for us to communicate with the property owner at all times. We want to let them know that right now, this is what we're doing, whether it is the inspection, the bid tour, the remediation project itself. You know, we want to let them know, and we provide update to them at all times of the project so that they have peace of mind that we are carrying out what we say we are doing, because there's a lot of distrust in the government agency, as you all know. And so having an open line of communication is really important to gain the trust of these property owners. Next slide. And I want to go over the HUD grant applicants who are qualified for this grant. This grant is open to the public. It's open to our open state cases, our potential cases, our surveillance cases, any housing authority tenants, but we do give priority to our open state cases and our potential cases and our surveillance cases. And I want to let you all know that because of this grant, we have been able to close out 95% of all of our open cases. That includes the cases in the past, and that includes the current cases that we're conducting EIs on. The only open EI cases that we cannot close out are the cases where the soil is below the threshold level, but the child is a soil eater, because we cannot utilize the HUD fundings to remediate any identified lead hazards that do not meet the threshold level. Okay.
Just a heads up, Dee, you got about 1 minute to wrap up.
Oh, okay. Next slide. Okay, and as far as our outreach goes, you know, we provide information during the health fair, during any kind of media, radio outreach, and during the remediation, we do post our sign, which is the Be Lead Free, out in front of the yard so that the neighbors can see it, so that they can contact us for information if they do want to enroll into the grant. Next slide. I think that's it. That's it. Thank you.
Michael, just checking in to see if you're ready.
Can everyone hear me?
Yes, we can.
Okay. Good morning, everyone.
This is Danielle. I just wanted to step in really quick. I know that we are running out of time a bit, so if you could just try to wrap up these slides as quickly as possible so we can get to our next presenter, who is Sony Johnson, who is still going to be presenting on Alameda County. Thanks so much.
Sure. Thank you. Good morning, everyone. My name is Michael Dang. I'm a public health nurse at Fresno County CLIP program, and I'm an interim CLIP coordinator. Next slide, please. So we're doing case management, and as we receive new case alert, we will identify whether the case need and interpreting services, and if they do need interpreting services, then we will contact our interpreting agencies to get appropriate interpreter for the case. In turn, we have the agency that contract with Fresno County, which is the Southeast Asian Certified Interpreters, Artists Interpreting Inc., and United Language Group that we utilize to assist with the case management. We tend to use the same interpreter to build a rapport with the family, and the interpreter become more educated and familiar with the process. So it's much easier when we dealing with the case, and we collaborate with our environmental health and our outreach services to reach out to the patient and the families and the provider. Next slide, please. For case management and HUD grant referrals, just in addition to what we presented, our health education specialist will provide education to the families regarding the HUD grant at the home visit, explain the goal of the HUD grant is to remove any lead source, whether it be paying or in soil, to prevent current children living in a home and future families from being lead poisoned. And for the state case management, it will be conducted by a public health nurse and managed by a public health nurse. We in turn will provide education to the families as well, in addition to our health education specialist. And we also did talk to them about HUD grant when we do our initial home visit, along with our environmental health specialist. We tend to collaborate and join force to do the initial home visit all together, along with our interpreter as needed. And we explain to them the importance of getting the HUD grant and get the house remediated for the safety of the child and anyone that live at the house. That's all I have on my part, and I'd like to thank you, CDPH, for inviting Fresno County CLIP program to provide the highlight that we do here at Fresno County to protect the children from lead poisoning. Thank you.
Thank you, Michael, and thank you everyone from Fresno County for all the work that you do. I want to turn it over now to Sony Johnson.
Hi, good morning. Happy Monday. Happy Lead Poisoning Prevention Week, everyone. My name is Sony Johnson. I'm with Alameda County Healthy Homes Department. This is a really special year for us, and so we're really honored to be able to do this presentation. This is our 30th year anniversary in where we've been dealing with lead poisoned children. And so we just want to share a little bit of what we've done, who we are to the community, and some of the work that we're currently involved in. So let's get started. Next slide, please. So today I'm just going to be talking about our outreach, and we call it Outreach 2.0 only because COVID has caused us to change us to do the work the way that we used to change it a lot, actually. I'm not even going to say slightly, but it was changed quite a bit. We're also going to talk about some health disparities and how to do outreach to make sure that there's a lot of inclusion, that we're including everybody in the outreach that we're doing. We'll be talking about using multimedia approaches, and a lot of that was because of COVID, because our face-to-face engagements, we just couldn't do them anymore. And then our community engagements were really key with ensuring that we could connect with the community. And as they always say, you want to work smarter, not harder. And this was one of the tools and tactics that we utilized that really helped us get through the last 2 years, along with community engagement partnerships as well. And then we'll wrap it up with some of the new and exciting things that we've done this year and that we have planned for the future. All right, next slide, please. So who is Alameda County? If you haven't heard of us, let me just give you a short introduction. We were actually, we started in 1991, and we were started from a grassroots organization called Pueblo. And so we actually have a lot of grassroots foundations. We were in the field, we were on the ground doing the work, knocking doors, and our primary concern was why there were neighborhoods in Oakland that had the majority of lead poisoning cases in Alameda County. And as a result, the county decided to put some funding towards this. We're completely grant funded, and so we work really hard to make sure that we can deliver the services that we need to deliver to our communities. However, we really hold on tight to our original foundations. We try not to have that appearance of a government agency. And so everything that we do is to ensure that the people understand who we are, that we're people too, that we have children that, you know, may have been exposed to lead. And we just really want them to know that we're here for them and we're part of their community. Next slide. Oh, I'm sorry. And then also in with that, we're one of the only agencies that have a multi-pronged approach. We combine health, housing, and environmental all in one office. And so we do have environmental health specialists that do the testing for us. We have contractors in our office that actually do lead remediation work. And then we have public health nurses that do the case management. All right, so now on to the existing health disparities. In Oakland, which is one of our primary cities, not all neighborhoods are made the same. And so we have a lot of at-risk populations. And because of this, we've known that poor neighborhoods, the ones that mainly have rental housing, those are the populations, those are the communities that don't really have the power to change the makeup of where they live. And as a result, they are facing a lot of health disparities. And something that we've noted is that with unhealthy housing, it usually means that the housing is substandard, that it's not properly constructed, it's not adequately maintained, and the residents are more at risk of illness or injury. And so because of this, we want to make sure that we are approaching the communities in the most equitable way possible. And so ultimately, it's a fight for environmental justice. Next slide, please. So with 2020, again, you know, it brought us some unprecedented times. That whole word unprecedented, I think it's the word of the millennium, and it was due to the COVID pandemic. And so we really had to make a lot of adjustments with not only the way that we live our lives, but also the way that we do our work. And so through learning lots of lessons the hard way, one of the main things that we discovered is that relationships and engagement was the new way for us to do our work so that we can still be able to reach out to the communities that we serve. Next slide, please. So equity and outreach is something that was really important to us. A child's health should not be determined by their zip code. And this was said by this former head deputy secretary, Ron Sims. And so what we discovered is that not everybody has Wi-Fi or computer access, and that the majority of our clientele, they actually use their cell phones or their smartphones for their main source of communication because they don't have laptops, home computers, or broadband at their homes. And so we had to really upgrade a lot of our facilities. We had to make our website mobile friendly. And then we also wanted to make sure that the ways that we were reaching people were ways that they were able to receive that. And so we did a lot of email blasts. We were on social media, which we weren't really on before. So Twitter, Instagram, Facebook, YouTube. We wanted to make sure that we were making our work as visual as possible. Next slide, please. And so what we did was we wanted to make sure that we created a multimedia communications where we were just trying to reach as many people as possible. And with that, we did text messaging campaigns because we did find out through our research that the majority of people utilize their phones. And then what we did was we coupled that with different campaigns utilizing radio, TV with our partners, and we would do contests so that we can engage our audiences and then elicit some type of action item for them so that we knew that they were receiving our message. We didn't want them just to listen, but we wanted them to act. And so we had text mask to 22999. When they did that, they would receive a message directly from us, and then in turn we would send them a free mask, and then we would be able to capture all of their information, their cell phone numbers, and then be able to utilize this platform as a new way of sending out information, email or text blasts to a new population that we were able to reach. We had great responses when we first started this at Lead Week last year. And then we also do a comprehensive approach with any of our campaigns, utilizing social media, utilizing, TV, radio, e-subscribe. And so it was very successful for us. Next slide, please. Because of the quick ramp up that we had to do with COVID, we ended up contracting out with a company called Busy Seed, and they are a multimedia social marketing company. They actually created social media ads and content for us. They were able to put us on a schedule to make sure that we had posts go out every single day so that we were becoming relevant, and that they were also monitoring any type of responses that we had. We didn't actually have the manpower to be engaging on social media, and so it was really helpful for us to consult with Busy Seed. We also did some mini campaigns. We did holiday campaign. And for us, what we're trying to do with our social media is to make sure that we are connecting ourselves with any type of holidays, any type of activities, current events in the community on a local level as well as on a national level. And so whatever is going on in the world today, we want to make sure that we make ourselves relevant, that we let the community know that we're engaged, that we are aware of what's happening, and that we're here to support them regardless of what's going on in the world. And then finally, we reached out to a lot of different media outlets, not just the traditional TV, but we did internet radio. We did, and a lot of these new outlets, they're able to target the demographics. And so we could target it by income levels. We could target it by race. We can target our audiences by the area that they lived in. And so this really helped us with our marketing efforts, especially if we were trying to reach certain neighborhoods in certain areas. Next slide, please. So community engagement during the early months of COVID was really important because we weren't able to get out in front of everybody the way that we normally did. And so what we did was we turned over to Zoom. And with the Zoom, we were able to participate as panelists on different national levels. We were able to host webinars or be a part of different presentations that were given through some of our partners. And again, that partnership was really key to give us the opportunity so that we were able to be in front of the audiences that we were normally used to being in front of. And then we also made sure that we involved our local politicians. And so we would do proclamations for Lead Week. We would ensure that our board of supervisors, that our local city governments were aware of all the programs that we have and the ways that our programs can benefit their constituents. And so again, just making sure that we engage people on every level that we can think of. Next slide, please. One of the examples that I wanted to share with everyone was an engagement strategy that we utilize, and it actually use the people that we're really trying to serve, which were the children. And so there was a school presentation that we did with Ascend School in the Fruitvale district of Oakland. This district is known for having soil contamination and older housing as far as lead poisoning prevention. And then there was a Reuters article that came out that targeted this neighborhood, stating that this neighborhood actually had more lead poisoned children than Flint, Michigan. And so because of this, we did I did a presentation to a class of children. And then with this presentation, the children actually decided to do some soil testing in their communities with the help of a local lab that paid for the soil testing. They got the results back, and then they created posters so that they can actually, posters and materials so that they can actually share their findings and their information with their community. And so they took on a social justice stance. They wrote to the local city leaders about what they were learning. And then with the posters, they actually got global recognition during International Lead Poisoning Prevention Week. And 8 of the children got recognized on a global level for the work that they've actually done. And so this was just such a great collaboration because they took the message and of lead poisoning and they made it theirs, and they decided to fight for their community and fight for their friends and neighbors. And so just wanted to share that great campaign that we did. Next slide, please. Some of the other partnerships and collaborations that we actually had, but we decided to strengthen, was really key, especially during COVID. And, you know, of course, I said, you want to work smarter, not harder, but in all honesty, a lot of these other partners, a lot of these other organizations, they do the same work and they have a lot of the same audiences. And so instead of working so hard to be in front of everybody and each of us giving one message, we decided to work together and give shared messages or give more comprehensive resources and referrals. And so you know, we worked with RAMP, which deals with asthmatic children. We also deal with a lot of our local clinics to make sure that we're getting their information out, and as well as they're sharing our information. And then also we have a Safe Kids Coalition and our Rental Housing Association. Next slide, please. One of the other examples that I really wanted to share was a really successful collaboration that we did on a on a national level, I should say, and that was called Soil Shop. With Oakland having the housing that we have that's extremely old, the soil is also contaminated. And so this was a partnership that we had with EPA, the Agency for Toxic Substances and Disease Registry, with ourselves, and we served as the health educators. The EPA served as the coordinators for the project. The CDPH, where we had environmental health, their environmental health investigation branch, they actually provided the testing with the XRFs for the soil. And then we also enlisted a local nursery who provided soil and gardening tips to the public. Next slide. In Oakland, we have a phenomenon where there's a lot of food deserts, which are in some of the poorer areas. And so to combat that, there has been a very high increase in urban gardens in the local Bay Area. And so because of that, and coupled with the older housing, there has been a concern about contaminated soil in growing fruits and vegetables. And so because of this, we decided that Oakland and the surrounding Bay Area was one of the prime spots to do our first soil shop, which was the first one conducted in the West Coast of the United States. And again, what this entailed was just free lead education, getting your child tested messages, the free soil testing, and then also just some advice on how and where to grow your vegetables. Next slide, please. With this, because it was such a multi-agency approach, we had so many, the partnerships were able to do a lot of promotional outreach. And with the 4 cities that we actually keyed on and focused on, we did some traditional outreach, and then we did some newer outreach. We went out to farmers markets. We did different community events that were available. We actually did we posted information on flyers. We utilized different community and gardening groups that are in the local areas just to promote the free soil testing, because there were a lot of people. And as a result, we had 46 samples tested in our very first soil shop. 26 people signed up for our mailing interest list, and we reached over 150 people. We ended up doing it the following year as well, and our results were even better. Unfortunately, because of COVID last year, we weren't able to do it, but we are looking to recreate this event, and it's completely duplicatable with other programs. And so if it's something that you're interested in, please make sure that you reach out to me. Next slide, please. One of the collaborations and partnerships that we have, because we do have a lead hazard reduction grant available as well, is with the East Bay Rental Housing Association of Alameda County. With this association, it's actually a property owners association, and this is one of the targeted audiences that's pretty hard to get in front of, because our traditional outreach to parents, to low-income communities is not the way that you get to rental property owners. And so with the collaboration of these with these organizations, we were able to talk with rental property owners and let them know what we can do to help serve them. And in turn, it actually benefits their tenants. And so what we provide is free rental property consultations. We provide free training and classes for the rental property owners, as well as their work crews or handyman that actually work on their properties. We provide the free EPA and RRP booklets that are required at the signing of the lease, renewal of the lease, or if they're planning to do any work on a property that's more than 6 square feet and the property is built before 1978. And then finally, we have free money to help with their lead hazard repairs. Next slide, please. And so it was really nice to have Fresno talk about their lead grants. We do actually have a lead grant as well, and we've this is, oh gosh, I think we've had a lead grant since our inception in 1991. And so with our particular grant, we have $10,000 available per property unit. And so if it's a duplex, they get $20,000. If it's a fourplex, that's $40,000. And so a lot of times money does talk. The property does need to be built before 1978. The family does need to be low income. And so we do work with a lot of the housing authorities and Section 8 rental property owners for that. And then we also have additional funds to help with other healthy housing issues, because ultimately lead is a healthy housing issue. And we want to make sure that the house is as healthy as possible. Next slide, please. This is just a quick slide on another partnership with just different families of young children with CAPE, Head Starts. And then for that, because we do want to still engage with the communities. We've developed some visual tools with our presentations or Zoom meetings to try and engage with the parents and get them involved with our meetings, with our Zoom meetings, not so that we're just presenting to them and talking to them, but really engaging them and having them understand and relate to the work that we're doing. When it comes to the different audience types that we actually reach out to, we have a vast difference in education levels, in languages, parents or grandparents versus rental property owners. And so our messages have to be concise, they have to be specific, and they're vastly different. And so to make sure that we know we're getting that the people are receiving our messages, we do a pre-assessment, sometimes with just questions. We make sure that our messages are visual and relatable. We have short surveys, and then most importantly, we ask them to have some type of action item so that they're doing something and that they're engaging. And then we do an assessment and follow up. Next slide, please. And so with the start of 2021, with all these lessons that we learned, we made sure that with each and every marketing campaign, we enlisted with our strategy a piece for equity, a piece so that we can measure the outcomes. We provided tools so that each of our audiences could actually engage. And then we wanted to make sure that each of our approach was very integrated, utilizing multimedia, utilizing our partners, utilizing collaborations, utilizing tools. And next slide, please. One of the campaigns that we did we called it March Madness because we wanted to go along with what was going on in the local news and in the community. And this just shows that, again, it was a very integrated approach, utilizing our collaborations, our social media, and a bunch of different tools and events. Next slide, please. And finally, some of the things that I just wanted to draw attention to as far as the campaigns that we're currently on. Our 30th year anniversary campaign. We just finished a back to school campaign. Right now, we're currently in our Lead Week. And then in the spring, we'll be planning a Spanish speaking DIY campaign. I'm sorry, a Spanish speaking DIY campaign. With all of these campaigns, we've utilized all of the resources, strategies, and tactics that I spoke about. Next slide. And finally, because it is our 30th year anniversary, I just wanted to remember our past really quickly. Back in 2002, we had a Let's Save Paint bucket distribution. This year, we have what's called a Bucket 2.0, where we're doing a do-it-yourself lead paint supplies that we're giving away free with a local hardware store, Laurel Ace Hardware. And then not only are we utilizing local media, but we're using social media now. So just the difference that 30 years makes. We've changed our logo from lead poisoning prevention to healthy homes. Next slide, please. And finally, I just want to really encourage everybody to go to our website, www.achhd.org. I want to just encourage everyone to sign up for our social media, to like us on social media, sign up for our e-subscribe. And then that way you can follow what we're doing throughout the years. Some of the great campaigns will let you know everything that's happening. So this is your action item to make sure that you're in the know with what Alameda County is doing. Next slide. And finally, this is just my contact information. Please feel free to contact us if you have any questions, if you're interested in some of the campaigns that we've done, some of the projects, if it sounds interesting, don't hesitate to give me a call. Thanks.
Thank you, Sony. Thank you for providing the contact information. That was one of the questions in the Q&A session. If you'd like, could you please go ahead and type it in there as well so the slide's no longer with us. So thank you, Sony. Thank you, Michael. Thank you, Christina, Anna, Dee, And Letty, for all of your wonderful presentations. You did a fantastic job, and I learned quite a bit about your program. So many amazing things happening out in the communities. And I do want to take a second to direct everyone's attention to the Q&A box, just so folks who may not have been paying attention can see some of the questions that were asked and some of the answers that were provided. And they may have a similar question. And so go ahead and take a look at that. And right now, we would like to open it up to any question and answers. Questions that anybody may have.
I can go ahead and answer Tracy's question. She asked if it's possible to obtain slides from today's presentation. Yes, we will be posting that on our website along with the recorded version of this webinar. And it should be up on our website in just another week or so. So thank you. And then I also wanted to just put a link in the chat for our survey. We wanted to leave you all with our post-evaluation survey for our webinar. So I have it as an answer. We need to fix this for our next webinar session and just allow the chat feature so that we could provide just better access to the link to our survey. But you can find that in one of the answers that I provided. It starts with https:// and then it goes into forms.office.com. You can find a link to our post-webinar survey there, and we really appreciate all of your feedback from today's session. And I'll hand it back over to Eric.
Yeah, we have two questions. I was thinking maybe, Michael, you could handle some of these as our PHN on board here. And the first one is, what is a potential case? One of the presenters mentioned this. Michael, do you have the ability to answer the question from the attendee?
Yes, potential case is the case that not fall into the category of the state case making, which mean the blood lead level is between 9.5 to 14.4. Then at that point of time, this will consider a potential case until the person is being tested, and if they met the criteria for a state case, then it will turn into a state case making. Then at that point of time, it will be a case will be followed up by a public health nurse as a case management. So any
Thank
case
you, Michael.
At the range between 9.5.
No, go ahead. Thank you. And if you want to repeat that again, sorry if I interrupted there. I just was going to refer to the other question that we had that was below. That is, the question is, what is the reference interval for blood lead for age 12 to 24 months?
This is Michael again. The reference interval blood lead level for age 12 and 24 months. Of course, the safest blood lead level is 0. However, if it's below 4.5, then we consider it's acceptable at that point of time. There's no follow-up needed, but any blood lead level between the 4.5 to 9.4, they will consider a basic case that will receive a education information from our health education unit team, that they will be contact the families through letter and educational materials will be sent out to the parent, and asking them to continue to follow up with provider for periodically testing the child to ensure that the child is less safe. If it's happened to be elevated and it's escalated to be a potential case or a state case, then it will be, of course, managed by whether health education specialist or potential case or a public health nurse for a state case making. So if the child missed the test at 12 months of age, then they could test it at 24 months of age. But ideally, the parents should be advocate for their children and asking the provider to test their children at a well child checkup at 12 months of age or 24 months of age. If they happen to miss both of those days, there's always a catch-up day that they could always ask the provider or a different provider to test the child at up to 72 months of age.
Okay, thank you, Michael. Very comprehensive answer. Hopefully that answered the question. We have another question here. Not sure if this is directed to any of the specific ones, but I think you could look at let's see, how were you guys able to get a public health nursing service to do home visits regarding lead poisoning? Was this service already in place that was expanded to include lead cases? Was this directed towards Fresno specifically or Alameda? I'm not sure who was using the public health nursing service.
Anna, I can just speak generally program-wide, maybe.
Mm-hmm.
There are a variety of different models around our 49 contracted programs in the state. Some programs, depending on high-risk areas, population size, and other factors such as that, might have an entire staff person or maybe multiple public health nurse staff who are completely dedicated with their time to the lead program and to childhood lead poisoning prevention services. Other counties have a public health nurse whose time might be divided between several different programs. So there might be leverage, as you were mentioning in the question, of a public health nurse who provides services for other programs in addition to the lead program. So there are a variety of scenarios across the state. But all public health nurses are trained and very competent in the services that they provide for the lead program.
Thank you, Anna, for stepping in to answer that question. We have another one down here. Let me check really quick. Is there a general assessment form for non-medical facilities, childcare facility, to assess possible lead exposures?
I can maybe find it alongside Danielle. I know we have some resources on our website of education materials and some checklists that are sometimes used in a variety of different scenarios, be it homes or other facilities, to assess potential lead hazards. And it has some visual pictures that you can go through that could be potentially a resource that might be helpful for you. I'll try to find that link.
Thank you, Anna. And with that, we're looking here to wrap this up. We've gone about an hour and 24 minutes here. So we are, let's see if we can possibly, someone could possibly put a link to our general inquiry email in the chat and give folks a chance to have that in case there is any follow-up questions regarding anything that they've heard today. So anybody that has that email really handy can go ahead and do that. Thank you, Danielle. And please pay attention here that we have and alert you to the fact that we just put the email address in the answers in the question and answer section section. If you have any questions, you can go ahead and send an email to this particular email address, and we will try and get back to you as soon as possible with the best answer that we can provide. So thank you again. And we also have the answer here that Anna had promised to provide regarding the general assessment form for non-medical facilities. And she's provided some references to some of the website resources. And remember, again, this is all being recorded, and you'll be able to access the recorded presentation on our website. And with that, I just want to thank all the panelists again and thank all the attendees for being here today. And I hope you have a wonderful, wonderful week and in celebration of Lead Week, and continue to visit some of our other webinars that we have. So thank you very much and have a good afternoon, everyone.